Hello, everyone. There's a question here, really, I think, interesting question here, a bit of a unique one, so I'm excited to answer that today. So this is posted on one of my other videos, and I'll just read it out here. So it says, I have tested positive for CIRS, which is chronic inflammatory response syndrome, but negative for mold, Lyme, etc. I did test positive for MARCoNS, which is this staphylococcal overgrowth in the sinuses, oftentimes associated with mold, and an overgrowth of Propionobacterium, which I am treating, but realistically, I don't think these are causing most of my symptoms. My symptoms match brain injury far more than they match CIRS or anything else, and concussion specialists think I have post-concussion syndrome. Could the brain injury be the sole cause of CIRS? So, great question. As per usual, can't offer any treatment advice over social media. Nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. But speaking about this, just from a strictly academic perspective, when folks have testing done to assess for chronic inflammatory response syndrome, it would typically include a panel of different markers like C3A, C4A. These are parts of the complement pathway in the body. These immune system related markers, TGF beta, MMPs. And if these are elevated above a certain range, then that kind of fits this picture of chronic inflammatory response syndrome, because these are cytokines, these markers that are associated with, that are indicative of increased inflammation in the body. And so the fact of the matter is that they're really, really non-specific. You could say, a person has elevated markers, those are elevated markers, and it's due to their neuroborreliosis. They have those elevated markers, and it's due to their mold toxicity. They have those elevated markers, and maybe it's due to long COVID, or maybe it's due to Epstein-Barr virus, or one of many different things that could cause inflammation in the body, particularly neuroinflammation. And by golly, concussions and post-concussion syndrome are very much characterized by elevated neuroinflammation. So one of the big criticisms, too harsh of a word, but I can't think of a better word for it. A critique, that's a nicer way of putting it. One of the critiques of running these markers to assess for CIRS is that they're really not specific. I've had patients come in and they say, yeah, I've got mold toxicity. How do you know? Well, I have all these, elevated markers, these inflammatory markers, so I have mold toxicity. It's like, well, maybe you do, but it might be related to Lyme or Bartonella or some other thing. Now, one of the counters to that critique is that, well, it is good in certain ways and kind of nice to have objective metrics to see, like, well, how's a person doing? If their TGF beta is through the roof, and then after 3 months of treatment, they're doing quite a bit better, and they get retested and they see it coming down. It's gratifying to see that happening. So there's certainly a solid argument to be made that it's worthwhile to do these markers, and sometimes for insurance purposes or various reasons, you kind of need something on paper that's showing that there's a problem. So not taking anything away from that. But these markers aren't very specific. So speaking from a place where I've treated many patients with post-concussion syndrome, or persistent post-concussion syndrome, or whatever you want to call it, and then of course many patients with mold and other chronic issues that can cause neuroinflammation, there is no specificity of these elevated CIRS markers to mold or MARCoNS or Lyme or Bartonella or whatnot. These are things that could be elevated in a person suffering from post-concussion syndrome as well. And the treatment is going to overlap a lot if a patient has neuroborreliosis, or they have mold toxicity, or they have post-concussion syndrome. There's going to be some overlap from the point of view that we want to reduce inflammation, promote some immunomodulation, because we want to settle down the microglia, which are ultimately getting overactivated and sort of driving a lot of this inflammation. We want to support that mitochondrial function. So we want to, regardless of which of those conditions might be driving the CIRS, we want to be toning down the inflammation, promoting tissue healing. The big difference would be that if a person, was quote unquote, just dealing with post-concussion syndrome, and they weren't dealing with mold or infections or whatnot, then of course we wouldn't have to worry about nasal sprays and promoting detox pathways excessively, and killing, working with systemic antimicrobials and things like that. Even some of the intravenous therapies that could be helpful, like say intravenous ozone therapy, spill over for all of those conditions, including post-concussion syndrome. But we wouldn't have to worry about things like low-dose immunotherapy and certain other things that are more specific for microbes or whatnot. whatnot. So thank you for the question. Just interesting topic. I was excited to talk about it, a little bit of a different type of question. So thanks for posting that. I hope that this answered your question. If you have any further clarification, if you need any further clarification on this, don't hesitate to post in the comment section below. And if anyone listening has any questions or has any input on this, if you have found SIRS markers to be really, really helpful for you, or they weren't helpful, or you have some experience that relates to all of this, please feel free to post in the comment section below. Be interested to hear what your experience has been. And again, any questions, just post them and I'll do my best to answer as soon as I can.